Welcome to My Hometown, the program that explores clubs, organizations, businesses, and issues across Nassau and Suffolk counties and sheds light on the different towns that are making a difference.
Hello and welcome to My Hometown. I'm Bill Horan, along with my co-host, Nassau Community College student Matt Leonard, coming to you live via Zoom and being socially distant as recommended.
Bill, have you ever heard of music therapy? We used to have a show on WHPC all about it, and now we have a chance to learn more about a company that provides treatment to families and individuals across the Long Island area.
They are Long Island Music Therapy. The name gets right to the point, doesn't it? Our guest today is the owner and founder, Lauren Klimek. Lauren, welcome to My Hometown on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much for having me today.
Lauren, first of all, how are you doing during these difficult times, and how have you made it over the last year?
Yeah, I think like with everybody, it still feels surreal, and I can't even believe it's been a whole year of this pandemic, but it's amazing how far I think we've all come, and not to say that times have gotten any, easier, but as humans, we adapt, and I think, we've adapted and we've all overcome, but it hasn't come without challenges for sure.
It's a good lesson. I guess you've been able to avoid the COVID, so that's another good thing. So, and hopefully your family also, so that life can go on. As difficult as it's been, at least it's better if we don't have it than suffering through it. So,
right, absolutely.
Matt?
So tell us a little bit about what exactly is music therapy.
So music therapy is the evidence-based practice using music to elicit a response and a positive change or an interaction to work on non-musical goals. So just as other therapists have their various interventions that they use, music therapists have music interventions. And what that is using live music with our clients. So whether it is instrument play, singing, using familiar structured songs to elicit a work towards a goal or an objective that a client is working on. That's what we do as music therapists. We use live music interventions with our clients to help them, overcome any obstacles that they may be having. If we're working in a psychotherapeutic framework, if we're working education-based or within special education, we're going to be working on those educational goals that a student or a child may have on their IEP or on their IFSP, and working in cohort with other therapists and with the family as well. And everything we do, within music therapy is all client directed, meaning that it's all person-centered, it's all individualized. We're meeting our clients where they are, and we're bringing music to them to help them achieve their goals.
Lauren, I'm laughing because as you answered that question, I'm thinking, you said live music, correct?
Mm-hmm.
I'm just picturing you as that typical that we see in movies, one-man band with an accordion, cymbals, a harmonica attached to your mouth, the bugle, etc. I'm sure that's totally incorrect. So I hope it's incorrect because somehow I don't see you. You're a very nice young lady that be in that picture. But how does that work in the real world? I mean, do you play an instrument for them to kind of get somebody, or is it permissible to play tapes or something?
So the way music therapists work is we're trained therapists, but also trained musicians. So you have to be competent on piano and guitar, and you have to utilize your voice within music therapy sessions. So we're not entertainers, per se, and that's not to say that what we do isn't enjoyable, to the client that is in front of us or the group that's in front of us, but we're using music with an intent, and that intent is to promote this therapeutic growth and positive change within the clients that we're seeing. So if I'm going to be running a group with maybe some elderly patients, maybe at a nursing home, maybe it's on a dementia unit, the songs that I use within that group are going to be maybe memory based. Maybe we're running a reminiscent group, for that type of client that we're working with, to get them to talk with one another and to reflect back on memories, to get them to start singing some song lyrics, right? Because we know that clients with dementia have a hard time with recall and with memory. But what's amazing is when we're working with that population, they have a hard time interacting like how you and I are, right? They have a hard time recalling maybe family members or friends. But when you put music on, they can recall some of them can recall almost every single word, to a song and tell you the date and where they were and what they were doing at that time. So it's really amazing how music can trigger parts of the brain.
It really is. And I never thought of that with the older people, but just that example right there, you've made the usefulness and how important music therapy is very important. Matt?
Why would somebody seek out a music therapist as opposed to, let's say, just a regular psychologist or just what we call, I guess, a regular therapist? I don't know if it's the term, a social worker or something like that.
So music therapy and music in general, it's a unique form of communication. It's not dependent on spoken language. So somebody may want to seek out music therapy if they're really having a hard time in verbal therapy. If, they're having a hard time finding those words, because you don't need words in music. You can work with the music therapist through using, live music interventions, through playing music with that therapist, because music is not dependent on spoken language. Music elicits feelings that are internal, in all of us. We all have this connection to the type of music that we're drawn to. So in music therapy, the therapist will utilize that type of music to help our clients. Words will come later because the work is happening through the music. It's a music-based relationship that you have with a music therapist. We don't need those words now. We don't have to put words to everything, immediately, like when you're sitting in a chair with a verbal psychotherapist. What we can do is use the music, and usually what happens is the music helps to elicit those words. It helps to make meaning to what's happening. If we're working with autistic children or disabled children or teens, adults, what we'll do with music is we'll look at the goals, that person has for themselves. We'll look at education goals. And if that client really responds well to music, they may want to explore music therapy, because maybe what they're doing in occupational therapy or in physical therapy or in speech therapy, maybe the music is that missing component, and we kind of come in on that other end and kind of make maybe the treatment whole for those individuals because they respond so strongly to music. So music can help, with speech and language and communication and relating to others. It can help develop functional skills. So that's what we see when we get a lot of referrals for autistic individuals or disabled individuals. It's because there's like a missing piece there. And music, because it's a creative therapy, can sometimes fill in that gap that's missing for that individual. And we kind of tie it all together.
Lauren, a few years ago, I went to a physical therapist, and the reason I was having problems with my shoulder. There's something hurt, or I didn't have enough mobility. So my body told me, and I think my doctor said, why don't you try a physical therapist? Do people just walk into your office or call for an appointment, or are you referred by a doctor or some other professional group or groups that say, what you need is music therapy? Because I just wouldn't think of that as one of the things if I had a problem, but I don't know enough about the subject.
Right. So music therapy is really gaining awareness, I would say, across, I've seen in the past couple of years across New York. And I've been practicing since 2011, and it has just, the increase and the need for music therapists and all creative arts therapists has really increased. And I think it's because people are looking for that other option, that missing piece, like I said before, something that maybe they're not getting from another therapy. So we're added into an addition, or maybe, one therapy isn't working and they seek us out. So to go back to your question, we get referrals from people's Medicaid service coordinators, from their self-direction brokers. We get referrals from some neurologists and from some other doctors. So let's say maybe we're getting a client that has cancer, their oncologist or their palliative team may reach out and refer them to us. If somebody is at end of life, We may get a call from their palliative team or a hospice care center as well, because that person or that family is looking to have a music therapist come in and help the family and the patient kind of process their end of life. When we get calls like that, sometimes we're working on leaving like a memorial project that some patients want to leave for their family. And that includes maybe some songwriting or them putting together a CD for the family so they can kind of leave that as their legacy. We call it a legacy or memorial project. So we get calls, honestly, from all over, because music therapists work everywhere. Music therapists can work in private practice like myself. And I have a team of therapists, I should say. There's actually 15 of us. We do have 2 art therapists as well. We are in-home providers. So we go to our clients' homes and we treat them there. Therapists also can work in schools. We provide related services in some school districts across Nassau and Suffolk County as well. So we're actually written onto a child's IEP. So we'll get a call from a parent that maybe wants to add music therapy, to their child's education plan. And then, we give them the resources so they can go back to the school district, or sometimes a school district will reach out to us and say, hey, we have a parent that wants to get an evaluation. Do you have somebody? We'll send somebody in, or we'll refer that out, accordingly. Like I said before, we'll get, calls from doctors' offices, neurologists, because there is neurological music therapists out there that really focused on the neurospecifics of the brain, and there's certain interventions that are used to elicit positive response and change there to help the client. We get calls from nursing homes as well, to come, hey, would you come and run, a group for our dementia unit, or just come and run a 1-hour group, for the residents here. We really want to get them to socialize more, get them out of their rooms. So we'll go and do that as well. Therapists work in hospitals, music therapists. If you go into New York City, there is a music therapist at every hospital, pretty much. And what you're starting to see here on the island now is that trend of having music therapists part as the integrative team in a hospital. It's starting to come out here on the island a little more. So Northwell Health has a few music therapists at their hospitals. So yeah, like music therapists, we work everywhere. We work in bereavement centers, hospice centers. I know I touched on that before.
I had no idea. You're really educating me, certainly, and I'm sure Matt, because yes. I just had no idea. This is, you're kind of the invisible people, I guess, because you don't have a sign up that says music therapist here, but it's obviously very important what you do and very interesting.
Right.
You are listening to My Hometown on the voice of Nassau Community College, 90.3 WHPC. My name is Matt Leonard. I'm along with Bill Horan, and today we are talking about music therapy with our guest, Lauren Klimek, the owner and founder of Long Island Music Therapy, a company that provides treatment to families and individuals across the Long Island area. My next question is it true that music is processed in a different part of the brain?
Absolutely. So music, as I was saying earlier, it's a unique, music is unique in the way that it's processed in the brain, and it's connected to, but not dependent on speech, movement, emotion regulation. It's developmental and it's organized, and it's experienced in many ways, and it's multimodal. So auditory, visual, kinesthetic, emotional, and there are different parts of the brain that are triggered when music is played. So you have the auditory and the prefrontal cortex. So that is going to help with recognition of pitch, tones. That's how we kind of figure out melodies. We analyze the melodies. The prefrontal cortex is responsible for rhythmic change and rhythmic patterns. That's what's picking up on that part of the brain. What type of music, I should say, is being picked up. The amygdala, when we hear, a song, maybe it takes you back to, a place and a time. And that's where the hippocampus comes in, right? That's responsible for memories. But the amygdala is that important part of the brain that deals with emotion and our feelings. So when you feel, and I think we can all relate, when we feel like this song that we just love so much, like you get a rush of feeling, running through you, you're also getting a rush of dopamine because there's heightened emotions happening. And dopamine is the reward and pleasure center of the brain. So neurons are firing, left and right when music is being played and we're listening to it, and when we're playing music too.
Lauren, again, being this is so new to most of us, where does a music therapist work? Do they just stick you in any office that's left around the either the hospital or the facility? Or do you kind of have a music-centered piano in the corner, drums, harmonica, flute, whatever it is that people like to hear?
Right. So music therapists work all over. So as I was saying earlier, they can work in school districts where we come in, and what we're doing is we're bringing our instruments in. So if I'm working in a school district, I may be actually seeing the student in the classroom, or maybe I'm pulling that student out and working with them in the therapy room that's designated in the school. We're doing consults with teams as well. So that's in a school district setting. I am in a private practice and a business, a small business. So our therapists, we go to our clients. So we're actually working in our clients' homes with them, just like a home care provider would. We're bringing our guitar, we're bringing small percussion instruments, we're bringing whatever we need to bring to that client to engage them and to interact with them. And to help them, through the music that we're bringing. That's the intent behind our music, is to elicit that response with them. If a music therapist is working in a hospital, they may be designated on one unit. Let's say maybe they're going to be on pediatric unit. That's very popular for music therapists to work because they work in cohorts with the child life specialist. Music therapists work in NICUs, working with the little tiny babies all, hooked up to the wires and providing rhythmic music therapy to maybe help with heart rate and with breath support, just creating, this transcendental environment to kind of try to help the patient kind of rise out of that hospital setting, because it can be scary being in a hospital. So I can speak for myself. When I interned many moons ago, I interned at the Louis Armstrong Center for Music and Medicine, which is based in Manhattan. It is part of the Mount Sinai Health System, and I worked all over the hospital. I had my designated tract was oncology and hospice, but I can tell you that I worked pretty much on every unit at that hospital. So music therapists can work on the psych unit. They can work on surgical step down. We did a large study on music therapy and how it can help with pain management. So that was a big study when I was studying over at the Louis Armstrong Center for Music and Medicine. How does music impact a patient and help them with pain? And it did, it helped to focus their attention from the pain onto the music. It helped to transcend them, from that stale hospital environment. So music therapists in hospitals work all over, unless they're on a specific track or on a specific unit. Music therapists work in rehab centers too. Substance abuse. South Oaks down in Amityville has tons of creative arts therapists. And what creative arts therapy is psychotherapy. Now, creative arts therapists, they are music therapists, art therapists, dance therapists, and drama therapists. So in addition to being a board certified music therapist, I am also a licensed creative arts therapist. I am enabled to practice psychotherapy in New York State. So any music therapist, art therapist, dance therapist, or drama therapist that holds a bachelor's and a master's degree can also become a licensed creative arts therapist if they reach clinical supervision hours. They have to apply for a permit with New York State. But if you hold a master's degree in any of those creative arts, you are enabled to, work towards getting your licensure. You just have to practice within a mental health setting. So I hope that's kind of clear. I know it's kind of confusing, but in New York State, there's that umbrella where creative arts therapists all fall under, and it's called creative arts therapy. You can still practice music therapy with just, your board certification. If you want to practice psychotherapy, you have to become a creative arts therapist in New York State.
Now, I have to use the lead-in line. If we're talking about something with a psycho, we're going to go right back to Matt because that's his specialty. So, Matt, we'll give it back to you.
Bill, come on.
I got you on that one. Lauren was on my side. She gave me the perfect lead-in.
All right. So how did Long Island music therapy come about?
So Long Island Music Therapy actually used to be called Long Island Sound Music Therapy. And I was a one-woman show. I had my day job. I started to hook up with, different agencies around the area, running some groups for disabled children and autistic children. So from that, then I would get phone calls for private sessions, and then I was hooked up, it was always word of mouth, parents, just seeing the work and believing in the work, and wanting me to come in and work with their child because they saw such an impact, and a difference in their child working towards their goals. And then from that, it just kind of spiraled, and speaking about music therapy, advocacy, I am always advocating for music therapy. I think, that's why you're starting to see, creative arts therapists starting to come out of the woodwork per se, and music therapists, because, here I am sitting here doing this with you today, and just kind of speaking to how powerful music is. So I founded, my company back in 2011, and it just kind of grew from there. And I changed the name, I had some children of my own, and I said to myself, I have to bring services, to Long Island. There needs to be more services. And it just kind of grew from there, and I hired one person and then another person. And then before I know it, here I am running Long Island Music Therapy, and also running another company called Accessible Arts NY. And that is our general arts programming that is open to the public. And we offer art, we offer music, we offer individual and group. And now there's 15 of us. I have 2 art therapists as well on our team. And our goal is to just bring these services, these much needed services across the island, and we come to our clients. Before COVID hit, my goal was really to, like I said, bring these services to our clients, because not everybody can leave their home or they can't travel too far. So before COVID hit, we were running multiple groups throughout Long Island as well. We were out in Nassau. We had a couple locations in Suffolk that we would rent, just to run our groups out of. And then COVID hit. So we've taken those groups virtually until we feel like it's safe enough to meet in small groups. And we are going to shift back to our group work in person, hopefully in the early summer. And we resumed our in-person sessions back in July. So, we went virtual, back in March. So that was interesting, because we were like, what are we going to do? Music therapy, there's always been telehealth, verbal therapy. That's always been a thing. But telehealth music therapy, how do we do this, with live music? And we did, and some people still do their sessions virtually, or their music class or their music lesson virtually. I guess at the beginning of our conversation, we've really adapted, Bill.
No, it's amazing how so many different professions have adapted. I want you to tell us a little bit about the work you do with autistic individuals, because that's something that I'm sure there's a lot of parents out there, if they hear that, may not be aware of it, as I'm not. Right.
So I would say the majority of the clients that we see are autistic or disabled. And we offer our services in our client's home. I do have a small home studio here as well. Before COVID hit, we were scheduled to get a clinic space. So I'm hoping that will happen soon as well, where people can come to if they want. But we bring everything to the client. We do an assessment, before we start a treatment plan with all of our clients. So we bring all of the instruments to them. If I'm working in a school district, same thing, before any service or therapy starts, there's going to be some kind of screening, intake, and evaluation that's happening. And then based off of that, and speaking with the parents, speaking with the clients, speaking with the other members of the treatment team, whether it be a speech therapist, a PT, an OT, we're going to develop that treatment plan. We're going to look at the needs of each individual client that we serve, because no one autistic person is the same as the other. And it's all about acceptance, and accepting the person that's in front of us and meeting them where they are, and working with them musically to achieve whatever goals they have, whether it's, communication, maybe they're non-speaking and they have a device that they use. That's totally fine. We'll work with that in a session. And when I say a device, some autistic people use a device to communicate, just like an iPad. We'll work with their programs within sessions to help them build upon those communication skills, those advocacy skills that they need, requesting their needs and wants. It's all about functional skills, and music is able to do that in a non-invasive and humane way.
Matt, your turn. This time I won't call you a psycho. So
all right.
okay.
All right. Thank you, Bill. I don't think I need the introduction this time, but thank you. Lauren, what advice would you want to leave with our listeners if anyone wants to become a music therapist, and what kind of training or schooling is involved?
Sure. So I'll just speak about myself. So I have a bachelor's in music from Queens College. I actually studied classical music and I was operatically trained singer. I thought I would go, do my master's and, be this opera singer. And that changed when reality really kicked in and when it was time to kind of transition into my master's program. So if you wanted to pursue music therapy, you obviously need prerequisites. You need some credits before, you can get into a program. You have to audition to get into a program. So speaking for myself, I had that bachelor's in music already. So I pursued the program at Malloy College, and I had to do some prerequisites, but I already had some of the musicianship courses that, it wasn't like I had to take a whole nother bachelor's degree. So they have a program set for people that have like just a bachelor's in music, or maybe a bachelor's in education, or a bachelor's in psychology. You do a couple extra courses, and then you get into that, the master's kind of track of the courses that you have to take. So there are colleges all over. There's Malloy College in Rockville Center, NYU in Manhattan. A lot of the SUNY schools have music therapy programs as well. SUNY New Paltz. Yeah, I would say actually almost all of them, I want to say, have it, but definitely New Paltz has it. Anybody can do a Google search and kind of figure that out. But I've just the best things to say about my experience at Malloy College. It was phenomenal, and just to come out of there, I was so ready, ready for the work and ready for the professional world, music therapy world.
Lauren, unfortunately, our time goes much too quickly, especially when we're learning so much as we have from you today. We want to thank Lauren for being with us today, and she is the founder and the owner of Long Island Music Therapy. Lauren, how can we get in touch with you?
We can be found at www.longislandmusictherapy.com. Or if you want our general arts programming, we can be reached at www.accessibleartsny.com. And we're also on Facebook and Instagram.
Again, thanks so much for being with us today. I'm Bill Horan, along with Matt Leonard. We thank you for listening to this week's edition of My Hometown.
We like to get your feedback on My Hometown. Send your comments to whpc@ncc.edu. Nassau Community College, where success starts and continues. Till next time, this is Bill St. James. And remember, there's no town like your hometown.